alcohol show. It's you, me, him, and Mr. Ripper. The alcohol show. The alcohol show. Hot so cool, liquor, give me now. It's the alcohol show. Real talk, real people, pass it to me now. Alcohol show. Yeah, pass it now. It's the alcohol show.
This alcohol show is brought to you by Contrib.io, your digital assets blockchain platform, Realty DAO, TLD fractional platform coming to you late this year.
You are listening to The Alcohol Show. Hi, my name is Jackson Fego, aka Jack Ripper, radio personality, and like many of you, or us, is currently having a hard time adjusting to all the uncertainties during this time of the pandemic caused by COVID-19. So again, don't forget to wear a face mask and face shields. It's a must-have, or a must-have. However you want to put it. Wash your hands for 20 seconds, follow it up with alcohol, and let's get to meet our katagais. Welcome to The Alcohol Show.
Yeah, so welcome to The Alcohol Show. Doc Jerry Allison. He's a medical director and emergency physician in an ed facility at Mansfield, Texas. I now pass the alcohol to you.
Hi there, and good morning.
Good evening.
Morning.
Thank you so much
Welcome
for
to our
inviting me
show.
to your show. And it's great to see you. Thank you for inviting me to your show. It's a pleasure to be here, and I look forward to chatting with you.
It's actually our pleasure.
Yep.
I'm Dr. Jerry Allison, and I practice here in Dallas, Texas. Mansfield is a community near Dallas, Texas, but also I am teaching at the University of Texas.
Wow.
Southwest Medical Center.
Wow.
And that's the University Medical Center, medical school here. And I work at Dallas Medical Center and a few other hospitals here. Medical director, fancy title. I help to oversee the emergency department and work with our physicians and other staff to make sure we provide the best medical care possible to our patients that come in.
Right. Where were you when you first heard about the pandemic?
Yeah, where was? That's a good question. You know, I don't remember specifically where I was when they said the pandemic. You know, we heard it coming out of China back in January and or December even, and we're watching it closely, and we weren't sure where it was going to go. I think in the beginning, a lot of people were hoping it wouldn't spread anywhere, and slowly, you know, and then slowly it kept popping up in different places around the world, and then the World Health Organization, announced it as a crisis, and then of course we banned flights from China at that point. So I remember that in January, and where was I? You know, probably just working, and it hadn't hit our emergency departments at that point, fortunately.
How did a pandemic affect your community, the facility that you're working at, and also your family? Right.
Well, that's a big question. That's a lot. How much time do I have to tell you all those things? There's, starting with the hospitals, the community, of course. The community lagged behind the hospitals. It started to impact the hospitals first, right?
Right.
And so, we started to limit the amount of people that would come into the hospital, and we were protecting. Our number one priority was protecting the staff, or the team, the physicians, the nurses, so that they didn't get sick. And then we would also keep families out of the emergency department. This was a big change here in the United States.
Right.
To not let family in. I mean, when somebody was having serious health problems, heart attacks and strokes even, we weren't letting anybody but just the patient into our emergency departments. And then really quickly, as you probably know, I'm sure in the Philippines as well, the PPE, as we call it, right? The personal protective equipment, right?
Yeah.
There was a limited supply.
Right.
You know, you've got 8 billion people in the world all wanting masks now.
Right.
And, you know, the problem in the hospitals is that you're going to go through masks and gloves, at least one per patient, almost, right?
Oh, yeah.
So even one physician or nurse is going to, you know, use a lot of equipment just for one patient, and in a shift, that's a lot of patients, a lot of equipment. So we found ourselves running out of supplies very fast, right? And so then we had to, you know, be innovative and creative. So our daughter went to her high school and spoke to the biology teacher who runs the lab there, and they have the goggles, you know, that they use during lab experiments, right? And we were able to get cases of those, and other schools did the same, and other hospitals did the same. And that was probably one of the first places that we went for additional equipment to protect our eyes. And starting to reuse equipment like masks and stuff. So that was very interesting. You know, our initial response and being able to adapt quickly.
Right.
We were fortunate that you know, the businesses were able to adapt as well real quickly and start to manufacture. I mean, we heard a story about a pizza place wasn't making any pizzas. They used their ovens to help make and bake certain products that they could use for protection, as well as people who were sewing or making things, right? We had to make a lot of ventilators are made here in the town where we live. So distilleries were making the alcohol, the hand sanitizer.
Right.
So that was the initial response, was very fascinating. The hospitals were impacted, and then of course the community, you know, our daughter even, and just like I'm sure in your communities, you know, were sent home from school, right?
Yeah.
People who were abroad studying had to come home. You know, it really impacted quite a bit, studying from home, and people weren't used to Zoom, right? Thank God for Zoom. It's really come a long way just in the last 6 months.
Yeah.
So, you know, but it certainly impacted the community or the families, especially when you're working, or you know, both parents are working, or mothers, single moms and dads working, and so now the kids are home trying to study. I'm sure you face many challenges where you are, just like we did here.
Yeah.
In trying to keep help our children to, you know, stay sane and play, study, you know, and prepare for college.
Right.
You know? So it's really challenging. So our communities, you know, and you know, after a couple of months, they kind of got tired of that, right? There's a lot of people who really are very diligent, you know, like my wife, who disinfects everything and does a great job of keeping. We've been very healthy and happy. You know, we're not sick, thank goodness.
Yeah, disinfecting.
So
I can imagine.
So, you know, and I think that's one of the keys. So, you know, this virus and this pandemic has certainly, and it's very interesting how there couldn't be anybody in the world that doesn't know.
Exactly. Yeah.
Unless, of course, you're living in the Amazon forest, which there are a few people, and thank goodness they're probably the healthiest ones out there.
What's up, Doc?
But you know, it's funny. Everybody does, and now people are used to wearing a mask. And if you're not wearing a mask, people look at you kind of like, what's wrong with you? Something wrong with you because you're not wearing a mask, right? Which is good. So you know, it's been a very interesting couple of months, hasn't it?
It is, and it still is. So how do you what do you think are the solutions that your part of the world is working on or is implementing to limit or stop the spread of this virus?
Well, that's excellent. I think there's a lot we can learn from each other. You know, here, I think what most people are doing and is just protecting yourselves and protecting the people around you, right? You know, and there's a lot of controversy out there. You know, how much is enough? How much is too much? It doesn't work. Well, I think we know basic public health, right?
Right.
And the Philippines is a leader in public health practices, and you know I know that because I studied there. And you know, washing your hands. I mean, that doesn't just protect you from the coronavirus, right? That protects you from all sorts of illness.
Right.
You know, covering your faces when you cough, or you know, just any time, right? When you sneeze. You know, before the coronavirus, you know, it was a little bit, but you know, we're not just protecting ourselves from the coronavirus now.
Right.
We're protecting ourselves from, you know, all the potential infectious diseases.
Yeah.
And what we've seen to a degree so far is a decline in some of the the transmission of some other illnesses. It's going to be interesting to see the response to the flu, you know, how the flu spreads to our community this year if we're doing a good job with washing our hands and covering our mouths, right? So I agree. I think we need to, especially when you're in those close confinements, right? When you're in a community that's very dense and, you know, you're traveling, sitting, you know, next to people and walking in crowds on the streets and in schools and apartments and everywhere. You know, washing your hands, watch what you touch, cover your mouth, you know, that's what, you know, wearing the mask, the basic stuff. I think that, to me, I believe is the most basic thing that we can do, you know. So and that's what we're doing here. So, you know, we do have people back in school now. We have our students.
Oh, really? Are
And-
they doing social distancing,
Yes.
stuff like that? Yeah.
So, you know, as you know, there's a lot of things you can do virtually. And so what they've done is try to split classes up. So
Right.
some can study at home while some are in person, so that when you go to the school, you just do the things that you can't do at home, right? So labs and, you know,
Yeah.
activities that you need to do while you're in school. And then when you're home, you can study. And actually, I think Zoom, I know there's some other platforms out there. Zoom is one of the better ones that I've worked with. Like right here, I'm looking at
Nawala siya.
and what we got over here, Jason, right, and Beth. You know, I can see all of you at the same time that I can't really see, even if I'm in a business meeting, right? This is great. There she is. Hey, Beth, there we go. So I kind of like this. And when the classes do this, the students have to actually be here. They can't just put their picture up.
Right.
So anyway, the kids are getting back in school, and that's good. You know, they're wearing the mask. They're washing their hands, doing all the stuff they probably should have done, you know, before. And,
Yeah.
trying not to spread germs.
This alcohol show is brought to you by Contrib.io, your digital assets blockchain platform, Realty DAO, TLD fractional platform coming to you late this year.
You are listening to The Alcohol Show.
Yeah.
Unfortunately, there's still some rebels out there. And you may have heard.
I've heard about it.
You know, our educations of higher learning, right? Where we
Okay.
send the smartest of our communities go, right? Yeah, you know why? I know why you're laughing. Because they get together and they forget how smart they are sometimes, right? Yeah, and so then they, get together. Our daughter Catherine, who you probably met when she was a baby.
Yeah.
She's now 20 years old, and she's what they call a resident assistant.
Wow.
So she gets her own place, apartment,
Uh-huh.
and she has to supervise a dorm for
Wow.
students. And so because of social distancing, of course, they're only allowing a minimal number of people in your apartment that you could have. Like every person could have one or two guests or something like that. And of course, you're not supposed to be drinking alcohol.
Yeah.
Well, 1 o'clock in the morning, she found a group of 8 students in one small room, and you see you have a trainee back there too. Very good, like it. Handsome boy. Who's that handsome guy back there?
This is Jaden.
Hi, Jaden.
Hi, Jaden. How are you? That's right.
And so you don't have to leave. So 1 o'clock in the morning, they're making a lot of noise because they didn't realize how loud they were. But they got a little bit of trouble because they weren't social distancing on campus. That was the worst. So you've got to be careful. All the sororities and the fraternities are the ones having a big problem right now, right? Because that's they're grouped together and they all want to have fun and everything.
Right.
I think this is a small price to pay for a short period of time.
Exactly.
And
Yeah.
So small sacrifice for the long run. It's not fun and it's different.
Right.
But it's also a challenge, right? I mean,
Yeah.
some of us are fortunate, and we have we can stay in our home and we can do a lot of things. But there are a lot of people in both of our countries who live in one apartment with 5 or 10 people, and right next door is another apartment with 5 or 10 people. And what are they supposed to do? You can't lock them up. I mean, they want to get out. They're gonna play. So, I understand it is tough for some people, but we just have to teach them at least, some good hygiene, good masks, just like Kim's doing, Beth's doing there, and that way they can try to protect themselves and each other.
Right. Do you guys have any questions for Doc Jerry?
Yes.
Go, Jason.
Yeah. Hi, Doc Jerry.
Hi there. Yes, Jason, how can I help you?
Yes. I have a question related to the current pandemic. Given what has happened since it started, how has it impacted or influenced the medical profession in terms of long-term preparedness and considerations? Because I think hospitals can't just have an inventory for any kind of problem that they want to anticipate or project, because budget is important, facilities, structures, etc. But given this pandemic, is there a notion that what if it happens again in 3 or in 5 years? How should we prepare for that?
No, Jason, that's great. Are you planning to run for president?
Actually, I will vote for him.
That is the type of thinking that we need in our leadership. Okay, I mean, right now, we're really just trying to get by day to day, but we can't forget, to start preparing now for the future. Yeah. So what are we doing? We've been actually fortunate, when they did an inventory of things like the intensive care unit, ventilators, we were afraid we were going to get overwhelmed, and because we did have some and we were able to move them around the country to different areas, we actually never ran out. Although, New York pretty much ran out of space just because they're so dense. There's just so many people in Manhattan and Brooklyn and all that. Yeah. So New York is a challenge. But most of the other places, like here in Dallas, we did have to open up beds, and we took places and made special COVID units so that only people that had COVID or were suspected of having COVID would be there. But we didn't really run out of ventilators, and we really didn't run out of beds yet, thank goodness. But we have to do. We had Ebola here. When a couple of years ago, it was here in Dallas where we
Really?
had Ebola. Right. Now we were very fortunate; it didn't spread, right, like COVID. Okay, because viruses work, different. Each virus has its own unique, features. But
Right.
we were able to contain it quickly. Fortunately, it spread different than coronavirus. But we have got to be prepared and have from our first responders, our EMS, the hospitals, and make sure that we have plans. And then, don't wait till an infection happens before you start protecting yourself like we're doing now. Right.
Right.
So, I know I can't tell you exactly how, Jason, but I can tell you that there are people working on this. It certainly needs to happen. Okay,
Right.
We can't wait till this is over, right?
Yeah.
But I think right now there's people manufacturing a lot of products.
Right. Yeah.
Probably at some point we're going to have so much out there that the price is going to drop, and we'll have so much. It'll sit around and collect dust until hopefully forever. We won't ever.
We hope.
Yeah.
Right.
Yeah.
So I don't know if that answered your question, but it's a question that needs to keep asking that.
Yes. Good morning. Hello, Doc Jerry.
Yes. Good morning,
This is
Beth.
Beth. So I'm sorry I'm wearing my mask because I'm in school right now.
Right.
So first of all, I'd like to salute you as one of the frontliners. I know how difficult to be a frontliner since my husband's also a nurse. I know how hard to be as a frontliner. So thank you so much. So my questions about the vaccine is now ready. What can you say about the vaccine that is now being issued around the world? Is there already a vaccine that is
Possible cure.
compatible to possible cure to fight this COVID-19? What can you say about this, Doc?
Well, first of all, Beth, thank you, and thank you for the work you do out there. Okay, I'm sure you all are probably working harder than I am. Okay, I know how tough it is to take care of patients, not just the COVID patients, but you've got to take care of other patients as well that are sick, and there's a lot of people that need your help. So thank you for that. Right now in the United States, there's no officially approved vaccine. Okay, now there are some places. There are some places around the world that say they have some or will have some soon. In the United States, I hope we do. And I do believe, there will be some people, some great brave people who will try it early. And I think it's worth, trying. If you're a high risk or you're worried about, contracting the illness. There's also something that just came out recently from some researchers where they may have an antibody which can actually block. So an antibody can actually fight infection. And they believe this antibody may even block COVID from entering the body or from entering the cells. So, I believe there's a lot of brilliant scientists working on this right now around the clock and around the world. And they're going to find one way or the other, whether it's a vaccine or a treatment after the fact. Now, I know a couple of things. One, let's see. You've heard about the plasma, right? So I have some friends here who have had coronavirus. Some that never had any symptoms at all, and some that have been sick. But they have antibodies in their blood. So somewhere along the way, they were exposed to coronavirus, and their body developed the antibodies to fight it. So they can donate that. They donate their blood, and then the plasma and the blood get separated, and then they can administer that plasma to other sick individuals.
Oh, more like a vaccine, or like antibody vaccine, right?
Right. They did that with the Ebola virus, as a matter of fact. When they found they got antibodies from the Ebola virus in some people's serum, and they were able to re-administer that to people who were sick, and it seemed to work, from my understanding. So they're trying it. The problem with this is, of course, you can only get it from people who have had it, right? Who have the antibodies. You've got to donate blood, and you can't donate all your blood. Right. Okay. You need to save a little bit for yourself, right? And the process does take some process to separate the blood and the plasma out, right? So it's not like it's abundantly available. But again, with the mountains of people that have been exposed to COVID here, you'd think we could get some. Now, how much you need in order to fight the virus too, I don't have that answer, but I'm sure we have experts who know.
Yeah.
Who know that, but that's certainly another opportunity to help people who are sick who've been infected with coronavirus.
Thank you so much.
Let's see. What else? How about over here, Darwin? What do you do?
Hi, Doc. Yeah, I'm a musician here in the Philippines, and we're the ones. And luckily, we were the ones being fatally hit by the pandemic right now. All the bars are closed. So we had to get out of our comfort zone, get out of the box. So it's
a fighter out there, huh?
Yeah, it's a big impact we have right now. Yeah. So I have also some American friends we have the same thing right now. Yeah, because I used to work in a cruise ship, couple. So I have many friends, American friends, who's dealing what we have right now. So it's quite hard, but we're getting into it.
And what cruise ship did you work with?
I was with the Celebrity before, then with the. Presently, I'm working with the NCL, Norwegian Cruise Line. Yeah, so
that's awesome.
Right now, we're supposed to leave like July, but all the cruise has been canceled. So,
yeah. Well, Charlotte, I certainly can feel for you, understand where you're coming from. We've got family and friends in the cruise industry and in the music industry. And one thing, you asked me earlier, how does this impact our community? A lot of restaurants, a lot of businesses have closed, even the basic stuff, right? And people like yourselves have been out of work. And, a lot of times, especially in the Philippines, you're the sole source of income for, some people, a lot of people, your family and stuff. So, we've been fortunate. I mean, I'm in the health profession, so, I'm still able to work, but, I can appreciate it. It's really nice to see people like yourselves, helping out in other ways while you can until you can get back to your jobs. Help the children learn, keep those kids in school, teach them good hygiene. I'll tell you what's been good around here is, the house has never been cleaner, and you can't go anywhere, so you stay home and clean and fix things and mow the yard, plant a flower, whatever you can do to try to make the place just a little bit nicer, right? But read a lot of books, certainly you can watch TV and stuff, but how much TV can one watch, right?
Yeah.
So I guess you can listen to podcasts, right? Why this podcast if you got nothing else to do in the
That's actually one of the trending things right now in the US. It's video and radio podcasts. That's why we jumped ship to podcasting.
Right. Well, I think it's great. A lot of people, a good way to communicate, and you can communicate all over the world.
Right. And nothing here is scripted. We just share your stories. That's it.
Impromptu.
Impromptu.
Yeah. Talk.
You bring up some great stuff about the hygiene. We don't want to forget about the basics, right?
Right.
Yeah.
If you can get rest and reduce sleep, or get good sleep, reduce stress,
Mm-hmm.
and eat healthy. Don't forget, your nutrition.
Right.
Those things can help you fight infection and be prepared in case you do get sick. Right. The one argument people have over here is, well, if I get sick, it's not going to be that bad, right? I don't care. Maybe I should just get sick and get it over with. But I think that's the wrong attitude.
Right.
Because, there's a lot of Lolos and Lolas out there. And if you bring that virus home and you get your grandma or grandpa sick, that's not good either, right? They could die from coronavirus. The older people with health problems. So, you could be a carrier. So it's not just about you getting sick or not getting sick or, how bad, but it's about the people around you as well. So it is important to continue to use precautions, protect yourself, and stay healthy.
Right.
So,
thank you so much for the opportunity to talk to you, Doctor. Who are literally in the battlefield. And I do have a last question.
Okay.
If that's all right.
Sure, I'm fine here.
Okay, so my question for you is this. What keeps you going in the morning or night when you have to go out, wake up, and do your job as a health practitioner?
Oh, wow. That's another tough one, Maida. You're good at asking questions. What keeps you going? Well, I love my job, first of all. Okay. I've just had such a wonderful career and opportunity to in the healthcare field. Been in here 35 years. A good part of that was studying in the Philippines and learning over there, and then coming back to the United States. And I feel just so fortunate. It's just great. So I love taking care of patients and educating patients, caring for them. So that's probably the best thing. But of course, as like the rest of us, I have to take care of my family too, right? And so that's my number one priority, really. And so the opportunity to work so that my kids can grow up and get good education and good jobs too. So that keeps me going. So it's fun. So sometimes you wonder, seems like Groundhog Day often, right? But if you can get up and today make a life better. Find somewhere. There's always somebody out there, right? That you can put a smile on their face, make them, get them a little healthier. Today's day is better than yesterday, right? So, that makes life worth living, right? So that's what keeps me going, and I hope that's what helps other people keep going too.
I think we've asked all the questions that we wanted to throw at Doc Jerry, and on behalf of the Alcohol Show team, we just want to thank you for your time. We thank you for your brilliant mind, and we thank you for your heart of service, being one of those on the front lines on a daily basis, even on emergency. So we know that, and we just hope and pray that you'll be kept safe, you and your family over there, as you continue to serve and just be there for the people around you. So we're all in this together. I think we all want to come out of it, but the important thing is we come out of it as winners. So letting our guard down is not a good excuse just because we're impatient about it, or we think or we believe that it's not going to affect me. That's the That's the worst thing that we should put in our minds right now. So thank you for your words of wisdom, Doc Jerry. We wish you Godspeed and continue to be who you are. And we thank you. We thank you for your time tonight.
Salamat.
Yeah. No, thank you guys. Thanks for reaching out. And, anytime if I can help you out or if you have some questions, I'm sure we could talk all night long. This is
like clinical questions.
So much time. But, thank you guys. Jake, pleasure to meet you. Jason, Sharman, Beth, Maida, good to see you again after all these years. And, keep up the great work over there.
Okay? Thank you so much.
Well, you're an inspiration to your families and your friends and your community. So keep it up.
Yeah, thank you so much, Doc.
It's our pleasure.
All right.
Salamat.
Bye now. You guys have a good day.
Say salamat. Say salamat, Doc Jerry.
Salamat.
Take care.
This alcohol show is brought to you by Contrib.io, your digital assets blockchain platform, Realty DAO, TLD fractional platform coming to you late this year.
You are listening to The Alcohol Show. Thank you for joining us for the short but sweet get-together of the Alcoholics Unlimited. Hopefully you learned something and enjoyed the Alcohol Show. My name is Jack Ripper, thanking you, and of course, see you on the next Alcohol Show podcast.
The Alcohol Show.